Okay, the first thing on the agenda is a public hearing. Public hearing around proposed changes to county administrative enforcement and appeals procedures ordinance, chapter 4000 of the Olmsted County Code of Ordinances. Oh, morning.
Jenna Gilbertson, HHH. I also have with me Tom Canan from the County Attorney's Office here to present just really a recap essentially of what was discussed at the Administrative Committee of the Board on October 22nd. So as you know, we have identified the need for some improvements to our local appeals ordinance, which outlines procedures that we rely upon when there is a disagreement about a county decision. And it covers a broad variety of things, various code provisions, right-of-way management, tobacco sales, liquor licenses. So it spans many county departments that work with this specific ordinance. And it seeks to give businesses or people who object to county department decisions a neutral decision maker to explain their objections and ultimately promote compliance with code provisions before any formal proceedings. So many of the proposed changes center around updating old language, former department names, those types of things. But it does also propose a fee increase associated with this process. The current fee has not come close to covering the county costs. So that is just a broad overview of some of the changes that are proposed in this ordinance. And we also want to let you know that since we were last before the Administrative Committee on October 22nd, this has been run in the Post Bulletin in compliance with all the regulations to do so. So anything else, Tom, that you want to add?
Any questions? Okay, so we're ready for the public. You got something, Dave?
You know, I do. Why? Well, I'll get my more major ones. So there was a provision in here where if somebody's aggrieved and they're injured in, if you will, apparently under the old way, there was an ability to come to the director of data practices and suggest that I don't have any money, but I'm aggrieved. I want to carry this forward. And apparently there's a way that that person could be helped. And we're taking that out. And so for anybody aggrieved that just can't afford to represent themselves before the process, if you will, do they have any other opportunity, or are they just not able to because they can't afford it?
One thing that I would highlight, Commissioner, that we added in is that there would be the ability to pay half of the fee upfront and half within 24 hours of the day of the hearing. So the fee could be split in that way, but that's the way that the language is written currently.
And what would have been the old system that somehow that we would just excuse the fee altogether for certain people, or probably never came up?
Yeah, it was on the books, but it actually never gotten used. But the way the process was supposed to work was that some of you may recall Dave Mueller, who's been retired a number of years now, filled this role, and that's was a reference to him, that the person would basically submit some documentation that would show what their ability to pay was, and he would have had the authority to have some latitude to modify what the normal appeal filing fee would have been. But like I said, we'd never actually encountered a formal request. I believe we've had 7 or 8 now administrative appeal hearings in the last couple of years. So
okay. Well, I mean, just to ask, I guess the county board can do anything it wants by suspending the ordinance, but so that would be an option, at least in a very, very, very special case, I suppose.
Well, per your direction that you gave us 2 weeks ago, you'd actually increased it more than the staff had anticipated. And so the way the ordinance reads right now, it's structured again as $1,000 filing fee. If you basically, there's support for revisiting that issue and going back to some kind of means-based filing fee, then we're going to need to revise the ordinance. And we'd go ahead and hold the public hearing today, but we'd ask for a couple of weeks probably then to tweak the language again to come up with something that the board would support.
The other one, just so I understand it, did we take out, and these are just the more major ones, it looks like we took out any provision at all, even though most of these ordinances are not necessarily directed by state law, some are, But to appeal back to the county board after the hearing examiner, that's not a provision anymore. You got to go right to court, the way it looks.
That's correct. Yes.
Okay. And I mean, that appeal process at the county board has probably been there since county board was established. I don't know that, but probably a long time. Was it just, and I don't know if we discussed this or not, but was it just thought at least that the county board, I'll just say it callously, that it doesn't have to be responsible for their own ordinances that they enact?
I think, just speaking for myself, the thought was that, I've alluded to this before, that there was a right-of-way access permit appeal that went direct to the county board about 15 years ago now.
Uh-huh.
And the staff that would participated in that felt that there was just a better way to handle it. Having a professional hearing officer, a professionally trained attorney who can listen to all the evidence, develop a proper evidentiary record that hopefully will be supported in the event there's an appeal, was just a better way to handle these matters rather than appeal directly to the county board. And so I think that staff was pretty unanimous that while it was necessary in the old scheme, if you will, before we actually had a hearing officer arrangement in place, it just really wasn't necessary and appropriate going forward.
And then so my last, I think, well, I could go on for a while, but I won't. We're extending, if your permit's revoked, it looks like you have to wait 2 years before you can reapply, whether you're a restaurant or anything. Anybody else that got a permit for anything, is that the case?
We'd run into a situation recently with a particular set of restaurant licensing appeals, which we hadn't run into before, where basically the appellant appealed a revocation of a food and beverage license, lost the appeal, and then turned around and submitted an application from a name of a corporation that was virtually identical to the license holder that had been denied previously, and said, it's a new operation, therefore you have to issue me a new license. So it was really intended to kind of address that kind of a situation where if the hearing officer has weighed in on an appeal, found that the department's revocation of the license was justified, we don't want to have a situation. It's really taxing on the staff as well to have them turn around and tweak a letter or two in the name of the applicant and say, it's a brand new business. You need to treat us just like we don't have any track record here of violating the applicable rules, and go forward then with a new application, only to find in this one example, for example, that they got in trouble with the same types of issues again very quickly, and we had to have another appeal after another revocation for the same kinds of issues.
Okay. And I can kind of understand that for a restaurant, a food establishment, but let me just ask to make sure that the same 2 years would exist for any other permit revocation for any other of the about 15 ordinances here, the way I understand it.
Yes, any of the ordinances outlined.
Okay. Mr. Chair, I think I'll just stop. I think that's most of what I have here. Thank you.
Sure. Any more questions
Yeah,
before we open
question.
public hearing?
I have a
Right.
question. So, how many opportunities does a owner or corporation have to fix the issue that the county brings to them before a revocation would occur?
Thinking of our most recent examples that we've relied upon this ordinance for, it relates to public health and restaurant licenses. And I don't know that I could give an exact number, but I would just say that it is many. There are many progressive opportunities to make improvement along the way.
So what you're saying is that you've worked with these people and worked with them several times, many opportunities. They've ignored all the help. And so revocation is really a last resort.
Exactly.
Thank you.
Anybody else? Okay, seeing none, I'll entertain a motion to open the public hearing.
Move to open the public hearing.
All in favor, say aye. Aye. Okay, public hearing is open. Would anybody like to speak about this? Second time, would anybody like to speak about this? Third and final time, would anybody like to speak about this?
Move to close the public hearing.
Second.
All in favor, say aye. Aye. Okay. Discussion, motions.
Move to approve the proposed changes to the county administrative enforcement and appeals procedure ordinance, chapter 4,000.
Second.
Okay. All in favor, say aye.
Aye.
Opposed? Carries. Thank you. Now we're on to consent agenda. A, approve the Olmsted County Board minutes from October 21st. B, appoint Ryan Catarella to the Parks and Trails Commission. C, appoint Dan O'Neill, Josh Kessler, Rajani Shoney to the Planning Advisory Commission and Zoning Board of Adjustment. D, appoint Gavin Oliver to the Sheriff's Civil Service Commission. E, appoint state transportation, approves state transportation fund grant agreement 1060661. F, authorize the Reading Center budget to be supplied to the Minnesota State Department of Education and the Minnesota Management and Budget. G, award contract for Graham Arena updates package 3. H, support local road improvement for High Forest Township. I, wheelage tax decision for July 30th, 2025 board retreat.
Move to approve the consent agenda.
I have questions regarding the consent agenda.
You want to pull an item?
I would like to pull an item. Yes, sir.
Okay, what item?
The wheelage tax decision, item I from
Okay.
July 30th.
Okay, so we'll move that on to next, then so,
Yeah, that's fine with me.
okay, so we got a motion to approve the consent agenda minus I. Can I get a second on that?
Second.
Okay, all in favor, say aye. Aye. Oppose? Yeah, that carries. So now we're up is the wheelage tax decision for July 30th, 2025 board retreat. Just someone want to speak about this, Travis?
Good morning, Chairman Tyne, Commissioners, Travis Granzi, Olmsted County Administrator. Just to introduce this item real quick, because we were aware that this was something that might warrant some discussion. This item is on the board agenda and on the consent agenda today because it was an item that was already approved at the retreat on the 30th of July, as it mentions here. What we were hoping to do today is just to acknowledge that that action was taken. As you all know, that official minutes aren't kept of our retreat discussions. And the day that this came up, the board took this action to increase the wheelage tax. And so to get it as a matter of the public record within a packet of minutes, then so you'll see that the action requested here is just to acknowledge that this action item taken at the July 30th board retreat as indicated on the attached resolution that was passed on the 30th. So that's the background. And I just wanted to acknowledge that, I mean, this is fairly unusual for us to bring an item forward that had already been approved, but we just wanted it, in the official record of the minutes here today. So
Yeah.
Thank you.
Bob, did you have a comment on?
Well, I do have a comment. I know that it was passed in July, but it was not passed unanimously. I did vote against it then, and I do not support it today. I just recognize it as a tax that people do not have a choice over. Every single time they have to renew their tags, they're going to have to pay that fee. And unlike a property tax, where very often if you're facing an increase in the tax, it's because the value of your property has gone up. So you might say that there's some legitimate reason for an increase. In this particular case, these folks don't have a choice. They just have to pay it. And for me, I don't support the increase in the wheelage tax.
Any more discussion?
Mr. Chair, just one, maybe a couple. Mr. Johnson here.
He is back.
Oh, okay. Do we, Ms. Johnson, do we tend to put signage on roads? Oh, okay. I thought it was by Travis. No, that's the reporter. Okay. Ms. Johnson, do we tend to, I've noticed in some cases, we have signage up this roadway, this highway, whatever it might be, is so-called, I'll say it in the vernacular, sponsored by the wheelage tax, so to speak. But do we tend to do that generally speaking?
Yeah,
Just
Commissioner
occasionally.
Ben Johnson, Director of Public Works. Yes, we do have a sign that we put up when we use wheelage tax for our pavement preservation projects. And that's what we use the wheelage tax typically for, what we have in the past.
I know, Mr. Chair, that's always kind of been, I've been impressed by that because people get to see what their money is being spent on, and it's an ongoing education piece. So appreciate that's all. Thank you.
Sure. Any more discussion? Okay, seeing none, I'll entertain a motion to approve the wheelage tax decision from July 30th, 2025 board retreat.
Move to approve letter I, the wheelage tax decision from July 30th, 2025.
Second.
All in favor, say aye.
Aye.
Opposed?
Nay.
All right, next up, informational items. 2025 Olmsted County opioid settlement funded work.
Hi, good morning, Mr. Chairman, Commissioners. My name is Sidney Fry. I'm a program manager here in Olmsted County for our crisis response service team. And I am here along with my colleagues Abby Tricker and Monica Zebel to provide you an update as it relates to our opioid funded initiatives, which is kind of an annual obligation that we have to present this information in a format in which the public can consume and be aware of what's going on with respect to the settlement funds that have been awarded within our jurisdiction. And so we can go ahead and toggle to our next slide if we could do that. So we have limited time today and just want to provide a little bit of context as where we're going. We're going to just talk a little bit about some level setting as it relates to how we got here today and kind of what has happened over the last few years. We'll speak specifically to our primarily funded initiative, which is our drug and alcohol response team. And then we have some new initiatives that have kind of since developed: our overdose fatality review team and our overdose spike response team. And then we'll also talk briefly about our Credible Mind resource platform. We can go to the next slide. So just to, again, level set and just look back retrospectively as to kind of how its funding source and kind of the initiatives that have kind of been birthed out of that have transpired over the last handful of years, going back to 2021, 2022. That's really when in earnest those settlements with the major pharmaceutical companies really were beginning to be resolved, and then those funds were being allocated respectively to states, counties, and cities. In 2023, Olmsted County announced that we would be receiving $7.2 million, and that funding would span 18 years. And as a result of that, we established our opioid settlement core team, which really was a cross intersection of different stakeholders from across the community to really kind of in earnest evaluate how we might best appropriate that funding. 2024, ultimately out of the outgrowth of that core team, which was a recommendation to the board to allocate that funding to start our drug and alcohol response team, which we affectionately refer to as DART. And so that was operationalized at the beginning of January 2024. In conjunction with that, there was a public service ad campaign known as Be in the Know, which was also launched in a parallel manner. So that brings us to year to date, 2025. In addition to kind of the initiatives, the ongoing work of the DART team, there has been an establishment of an overdose spike response team, and my colleagues will be sharing a little bit more information as it relates to that, as well as the overdose fatality review teams. So we can go ahead and toggle to our next slide. Just again, as a refresher, for a little bit more context, as it relates to the funding, there was core abatement strategies that we were kind of regulated to target and to make sure that these were best practices that kind of had been rolled out nationwide to all respective jurisdictions. And so there was a handful of those abatement strategies, and we focused on broadening access to naloxone, enriching prevention strategies, and funding warm handoff programs. And so we see kind of the work that has subsequently been initiated, really checking most of those boxes, or all of those actually, being able to provide training and also dispensing Narcan in our community. There's community education opportunities that we've been afforded through the work of DART, as well as some other parallel initiatives, Credible Minds being one of those. And then really that warm handoff program is really kind of the meat and potatoes of what DART does on a day-to-day basis, providing that treatment coordination and really providing some gaps that we saw in our service delivery within our community. We were able to expedite things in a manner that we haven't previously been able to. All right, we can go to the next slide. So this is just some face shots there for you. As far as, so if you see people in the hallway, you can put a name to a face. This is kind of the team, as it were. We have 2 licensed alcohol and drug counselors, and our lead social worker, Monica, will be sharing here shortly. And then we also have 2 peer recovery specialists that are a part of the team as well. All right. With that being said, I'm going to relinquish my stand. I'm going to turn it over to Monica. She's going to come up and share a little bit of some of these outcome metrics with you all today. Thank you.
Hi, everyone. My name is Monica Zabel, and I am the team lead of the Drug and Alcohol Response Team. So looking at these numbers up here, these are going to be since the inception of DART. So we started providing services, as Sydney mentioned, in January of 2024. And since then, we've been able to work with over 800 unique individuals within our community. We've received over 1,000 referrals at this point. We've had over 8,000 contacts with clients and or family members or supports. So this could be in treatment coordination process with probation officers, the jail, public defenders, and treatment services. We've been able to provide some education to the community and trainings. We provided trainings to all the Rochester Police Department officers through their spring training last year. We have spoken with all of the Olmsted County Sheriff's deputies and continue to provide those trainings when there's new hires on both of those respective teams. And that shows through the 230 plus community connections and collaborations. Then looking at assessments, that's an important part to the treatment process and connecting individuals to care. And so Kristen and myself were the 2 on our team that complete those evals, and we have completed today around 280 assessments. And that's really the first step, is somebody has to have an assessment in order to get into treatment. Looking at how successful we are in contacting individuals, we are able to make contact with individuals and or their supports 85% of the time. So we utilize all of our resources and community partners in order to find them. Sometimes that looks like us going down to the jail. Maybe we're going to detox at CRU. Maybe we are going to Mayo Clinic. They allow us to come in there, complete assessments, meet with our clients and our referrals. Additionally, sometimes we'll go to the Landing or Salvation Army. We'll be in the Skyways trying to find these individuals that are referred to us. So we're really working in different atmospheres, trying to locate these individuals and offer them supports. And then one of our biggest priorities is following up on overdoses. So every time there is an overdose in Olmsted County that was called into law enforcement, our team is notified in the morning with the police notes. And so we're able to check those, see what happened with this person. Was it a fatal overdose? Was it a refusal to go to the hospital? Did the person end up in the hospital? And then we go follow up with them, see if they're interested in services. People are most likely to engage in services following an overdose if we follow up within 12 to 48 hours. So through that, we've been able to complete over 150 post-overdose outreaches in Olmsted County. And typically that looks like offering the person Narcan and or their family member, whoever was present at that overdose. And then also we work to get them connected to any services they're willing to engage in, whether that's outpatient, inpatient, peer services, mental health, etc. So looking at numbers and, if you will, kind of some success rates, we've been able to place over 53 individuals into our PAR beds. Those are the police assisted recovery beds. So we have 2 beds at Docks and then 1 bed at Teen Challenge. And those are beds where individuals who are interested in long-term recovery can go and they can stay there, be in a safe, stable place with supports until they're able to get into a residential treatment center. Maybe you're released from jail, released from the hospital, detox, done the hard part of the detoxing of the substance, and now you have to wait a week to get into treatment. And so that week is unbearable for most people, which is why we're able to place them in these beds and have them be in a safe place until that treatment bed is available. Then we have been able to coordinate over 400 treatment admissions, and that's to all levels of care, including outpatient, inpatient, medication-assisted treatment, and then peer recovery services. Next slide, please. So going to 2025 today, what we've been working on recently is we've been establishing an overdose fatality review team. This is an innovative process that the state has created to address drug-related overdoses in our community. And the purpose of this team is to conduct a thorough review of fatal overdoses within Olmsted County to better understand what are the circumstances around this death. Did they have connection to resources? Were they involved in the probation system? Were they involved in law enforcement situations? Had they been offered services through different resources and organizations within the community? Where are the gaps? What could we do better as a community? And then work to provide recommendations to our governing team, which is individuals in high positions of leadership that are able to approve and hopefully help us push through some of these recommendations to their respective organizations. And so this is, as I mentioned, through the Department of Health and Injury and Violence Prevention section. They've helped us begin this process, help show us who needs to be involved and what our next steps are to conduct these reviews. And just some of our partners included are the Rochester Police Department, Olmsted County Sheriff's Office, all the Olmsted County HHH directors, Olmsted County Sheriff's Office, the jail, staff, local treatment centers, our detox here, the City of Rochester Public Defender's Office, and the list goes on. So we're thankful to have all these organizations agree to participate in this with us because we would not be able to do it without them. And I'm going to pass that to Abby. Thanks.
Thank you again, commissioners, for having us here. So I'm Abby Tricker from Public Health, and I team up with Monica on a lot of these different strategies. So I'm going to take the last half of the presentation that will highlight our overdose spike response plan and team, along with the Olmsted County's Credible Mind website. So in addition to getting this overdose fatality review team started up, we're also creating an overdose spike response plan. So this will help our community plan for, respond to, and evaluate public health and community responses to overdose spikes. Public Health and DART leadership are coordinating this work and bringing partners together from sectors such as law enforcement, healthcare, treatment and recovery organizations, and many others. We're also partnering with the Minnesota Department of Health and the High Intensity Drug Trafficking Areas Program, or HIDA, which will be providing support, including technical assistance on plan development and implementation, coordination of a tabletop exercise to test the plan, and then monitoring data and communicating overdose spikes with local contacts. So our local Olmsted County overdose spike response team will develop a context-specific response to overdose spikes, taking into consideration local drug trends, overdose frequency, and public health and public safety resources. Multiple factors may trigger an overdose spike in a jurisdiction. Some of those include changes in the illicit drug supply or bad batches and changes to illicit drug trafficking patterns. It could include limited access to behavioral health and mental health services, recovery support and harm reduction services, things such as a global pandemic, dismantling homeless encampments and other social stressors, and then changes in access to prescription pain medications or treatment. So all of these different things can trigger a spike, but it often takes some time to identify what the root cause of a spike may be. And so this plan is helpful in establishing what we can do to take swift and effective action to mitigate harm, whether we know what the cause of the spike is or not, which then leads to saving lives and giving us time to figure out the full picture of what's causing the spike. Next slide.
Sure. Just 1 second.
Yeah,
So just curious.
Yeah.
Tell me, a year and a half ago, if we saw 3 overdoses in a weekend, what would it have looked like? And why are we better off today that we're all at the table? Was it very siloed?
yes.
Speak through those improvements.
Yeah, so prior to getting this plan and group in place, the communication between different organizations, law enforcement, EMS, it's all been relatively haphazard.
Okay.
And so this will give us a chance to have all a unified message and a response going forward. And this is identified. The other thing that's helpful is that the Minnesota Department of Health actually is helping identify those spikes. So it's not relying on us locally, and they will communicate with us that, yes, we're seeing an increase in overdoses using EMS data and law enforcement data, and communicate that back to us. Then like triggering whatever that response needs to be.
Because previously, even that data coming back from the state wasn't very consistent, didn't happen all the time. So we're seeing improvements there.
Yep.
Great.
Mr. Chair, just to follow up.
Sure.
I was going to wait till the end, but since we're on, so we wait till the Department of Health tells us that we've got.
No,
that
not
we have
necessarily.
Four overspikes yesterday, for instance. We wouldn't do that, would we?
No, not necessarily. So if we recognize that there is
Sure.
a spike with our local data or law
Yeah.
enforcement calls or an increase in folks going to the emergency department, we would respond in that situation as well. And we would communicate back to the state about
Sure.
that too. So it's,
I would think it would take a week or two before the state would.
yeah, in some
knows?
cases,
But
depending where the
happen
source
overnight.
of the data is coming from. Yeah.
Thank you.
Okay. All right. So I'm going to switch gears and now talk about Credible Mind, which the county has had for almost 2 years now. And I know we've come and spoken to you all about Credible Mind before, but I'll give you a quick overview. It's a digital platform offering a wide range of mental health and well-being resources, including articles, videos, podcasts, and self-assessments. It provides personalized evidence-based content and support for individuals. And its platform is also used by organizations like employers may use it for their employees, health systems, and communities to support their populations. So the platform can be used for many different topics. So much of it's focused on mental health, so anxiety, stress, and burnout, but it can also include access to more localized resources, in addition to the tools and articles, podcasts that the Credible Mind platform itself has available to the community. So this graphic that just shows the traffic to the Olmsted County Credible Mind website from its inception, which was mid-December 2023 till, in this case, October 10th. Next slide. And then this again is looking at the time frame of late 2023 to mid-October of this year. And you can see that most visitors are new users, with a little over 1,000 being returning users. You can also see regarding what's like the most searched topics, The most viewed topics include depression, which is by far the most the topic looked at the most often, followed by anxiety and some other mental health type topics. And then I'll have to go to the next slide. Looking at local resources. So we're able to include and add local resources onto our county's platform. So here's just a list of some of the top resources or the resources getting the most clicks. And you can see Olmsted County's mental health resource page is, again, by far the resource getting the most engagement, followed by our substance use resource page and our parenting resource page. And you can see too, there's a variety of others that go down the line. Next slide. Okay, so this last piece is users have the option of taking quick, simple assessments that can give a snapshot of where a person may be regarding mental health, includes personality traits, attachment styles, risks of burnout, and more. If you look at the top assessments taken by users, you can see that mental health and signs of depression or anxiety are those top two assessments that are taken. And this just gives folks an idea of like, maybe if I'm struggling with depression or anxiety, it could be the thing that makes them pursue to getting help. So it's kind of like, okay, here I can take this quick assessment and looks like I'm struggling, which you probably knew, but it might be the one thing to get someone to take that next step. All right, so we appreciate your time today and the opportunity to provide updates on the efforts funded by the opioid settlement funds. Before we wrap up, we'll open it up. If you have any other questions or thoughts you'd like to share with us, we are open to hearing.
Mr. Chair, I do have a thought. Because I see in the audience the post bulletin, I see the medical examiner, we have our opioid response team in public health here. This might sound like a non sequitur, but I feel like I have no better opportunity than, and it does connect in with your opioid presentation. I have no better opportunity to express a sentiment that I'm hearing from a physician friend of mine who's increasingly dismayed by how drug-related deaths are characterized in the media and in the newspaper in particular. She wonders if deaths that are considered drug overdoses are actually poisoning from what you call the bad batch. So she's concerned that toxins, contaminants, and poisonous substances were the agent of that overdose death, as opposed to the narcotics themselves. And only an autopsy could show if it was poisoning or a narcotics-related death. And so while we have the post bulletin here, I'm wondering about a larger discussion about how to correctly characterize deaths that are a result of bad batches, as opposed to just the blanket categorization of drug overdose. It might actually be more that might be inaccurate, and it might be more nuanced than that. And I have not had a better opportunity with more key players in my audience just to state that publicly.
Appreciate that. I feel like Monica may be better suited to answer or respond.
Yeah. So that is part of the purpose of the overdose fatality review team is we do have medical examiners on that team, and they'll be bringing those autopsy reports for all of the fatal overdoses. And then through that, we're going to be able to categorize them further of, is this actually meth toxicity, or is it a heroin overdose, fentanyl, mixed substances? And so we're hoping to be able to identify some of that through that group.
Thank you. That's great to hear.
Abby, I got a question on your, I guess 4 slides ago, one looks like an EKG.
Got it.
So
Yes.
what drives the spikes in the valleys?
Yeah, so we've been doing concerted efforts to get folks to the Credible Mind site. And my assumption is that those spikes are in conjunction with
With
when
our
we're
effort.
doing that outreach.
Okay, all right, well, that makes sense.
Yeah.
'Cause
Mhm.
otherwise I'd expect it to be more of a straight line.
Level,
Yeah,
yeah.
Mr. Chair, just looking at that, I mean, January, about March and about October, I don't know if that's when you did your promos or not, but it just seems to me there is inordinate spikes at those points that are significant above what the
Mhm.
so-called base is. And
Yeah, I know early on, we were doing many presentations out
Okay.
in the community and to different organizations pushing this resource, so folks were aware of it. The other spikes could be related to like working with UMR. They created some like posters and promotional materials. So there's just a variety of things that have happened throughout the time span that we've had this resource and platform. So yeah, my assumption again is it's more related to
our efforts.
our efforts of promoting it.
I got another question then. So every county in the state got these funds. The major cities like Rochester got these funds. I think Native American communities got these funds. What are they doing compared to what we're doing with those funds?
Is a great question. So there's a lot of different innovative things that people are doing across the state. I actually spoke with someone from the St. Cloud area yesterday because they were curious about what we were doing.
Sure.
So I would say a large majority are doing community grants. So providing grant opportunities for other organizations in the community to do this work. There are a few of the drug and alcohol response team-like efforts. I don't think that's something as prevalent, though there are a few communities up in the cities, and I know in Duluth they have one because that's kind of how we modeled ours.
Okay.
With the Duluth one. I can't remember what it's called. There's like these a company that creates bags that have like drug neutralizing. I don't know what you would want to call it. Product
Disposal.
inside doTERRA, I think is what it's called. So getting those bags out to community members so they have a way to get rid of their prescription drugs. So some are spending money on that. There's a few others that are doing overdose fatality review committees and the spike response team efforts, but that's pretty limited. From what I understand, I think there's maybe like 3 or 4 other communities doing the spike response team in Olmsted or in Minnesota. But
So at some point where will all these communities get together and talk to figure out what's working, what's not?
yeah, well, so we do meet on a probably now quarterly basis where it's more of a just sharing session and talking through what's working, what's not working. But it's not super regular. It's more of an open conversation. We do annual reporting. So the state does have a record of how every community is spending their funds, and there's evaluation metrics that we have to include in that. So you can go on DHS's website to look at that. But I don't know if there's been any effort to really like highlight specific strategies that have been especially successful at this point.
think it'd be a good opportunity to do that. So if
Yeah.
the state should take charge of that.
Yeah, that would be helpful for sure.
So we've got X amount of, I'll get you, Greg, we got X amount of dollars. So how many more years do we have for those dollars run out?
Well, so how we're spending, we're gonna run out before the 18 years. I would have to look back at our budget to see where we're sitting at now. And I do believe we're supposed to get additional funding because of other settlements.
Yeah.
So I can't really say, but I can get back to you all if you're
Okay, so we're curious about 15 years left then probably.
probably, yeah.
All right, so at some point the board's got to make a decision on, How
On
we fund,
continuation of the work without funds, yeah.
okay, Greg.
Oh, thank you.
Yeah.
Do you have any preliminary information about the overdose fatality review team? So what is the overdoses actually due to? Any?
So we're just standing up the fatality review team. So we have had our initial meetings introducing the players to what the process is and the purpose of it, but we have not held an actual review.
Yeah.
That's planned for.
Don't have enough
January.
data to make
Well,
a decision.
Yeah, we just haven't had
That's
the
fine.
opportunity to meet yet.
I'll be interested in when you do have some information. Thanks.
Yeah.
Dave.
So I have maybe several, we can go through them real quick. Going back to your core abatement strategies, provide community-based trainings and so on. Like who's been trained and like just ballpark, is it 100 trainings or 20 or 10 or 5 or who do we train?
So we train anybody who is willing to listen, anybody who's interested in learning more about substance use, whether that's signs of overdose, getting overdose response training for like just to administer Narcan to patients or individuals. And then,
Can I just ask, could a citizen of a troubled youth
yes,
be trained?
anybody.
Okay.
So we have done trainings at the Rochester Public Library to the community. So those have been open to anyone. Trainings to the police department, sheriff's office, Byron High School teachers have asked for training. We ask at different organizations, hey, are you interested in this? Could we provide this service to you? And then also if they're willing to host trainings or just provide a space for us to have them for community members. So students are also included. We work with Rochester Public Schools to provide those trainings. And for my background, I'm a drug and alcohol counselor and clinical social worker. So that's where the trainings are coming from myself, and then other drug and alcohol counselors typically are providing those trainings to community members as well.
Okay, my next one, if I were, how would I find my way into DART and what would happen to me if I was in DART?
Yeah, so first, there are a couple entry points. One is going to be just calling us directly. Our phone number is on the Olmsted County website. Another way, we have wristbands, and so we use those for a lot of our unhoused folks. We hand those out and they have the DART number on them. They don't have to put it in a phone. They don't have to write it down, lose a piece of paper. They can just wear it on themselves and give us a call. That rings to our team phone. Any 4 of us would answer that and then just see what that person's looking for and start from there. Sometimes it's the individual themselves looking for services. Other times it's family members that are interested. How do I help my loved one? And then we talk about what are you looking for? Are you interested in learning about the treatment process, getting somebody into treatment, getting yourself in? And then we work with them to help meet their needs as best we can.
Okay. So my next one is, so the overdose fatality review team, and I understand it's probably new, but can you tell me or anyone, how many overdose deaths did we have in Olmsted County in, say, 2024? Do we know?
We'll know that in 10 minutes.
You're going to tell us. All right, we'll find out.
Bet
All right.
for them.
Mr. Chair, I think that's it. Thank you.
You.
I got one more. I assume the number of overdose deaths go down, the more Narcan that's out there, but what's the trend on the number of just overdoses?
On overdoses. So, I mean, specifically looking at like fatal overdoses, one thing that we have seen from the state's data is there had been a decrease looking at 2024 in comparison to 2023. However, in 2025, the preliminary data is showing us that there has been an increase in fatal overdoses. Specifically, looking at the month of September is the most recent data that we've had. When they compare 2024 September to 2025 September, there is an increase. So still waiting on more information on that for those to be confirmed. But I want to say there was around 400. Some, like we talked about, the data getting reported isn't always the most consistent. There are a lot of people who use Narcan in the community and that never gets reported anywhere. And so there are a lot of overdoses that are missed within the data. Some of our sources have reported 400 overdoses last year or response to 400 overdoses. Others have reported responses to 600. And so somewhere in there,
How's that compared to the year before?
less. So 2024 is less than 2023. However, like I said, we think we're going to see an increase in 2025 just based off what the state is showing us for Minnesota as a whole.
So in 2024, we had less overdose deaths and less overdoses. This year, we're seeing more overdoses and more overdose deaths.
So far from the preliminary data.
Okay, that's not good.
Mr. Chair, just one last one.
Yeah.
Not even a fair question, but I'm going to ask anyway because I don't have anyone else to ask. And you're the professional experts, at least as I see it. So what is the drug problem? How would you characterize the drug problem in Olmsted County?
As far as top
10 is
substances?
awful and 0 is wonderful.
Gosh, that is a hard question. I think it's,
I mean, we all think it's pretty serious. I do at least.
yeah, it is serious. And I mean, it's
Yeah.
comparable. I don't want to say it's comparable to larger counties because of the size population differences, but it is serious. And I think as a county, we should be concerned about the substance use here. And the primary substances that we are seeing on the drug and alcohol response team when we're assessing individuals are going to be issues with alcohol, methamphetamine, and fentanyl.
Is it fair to say, and I would just judge our community or our county as being compared to other counties, we just all know that the economic vitality of our area is much greater than other people. And I don't know if drugs follow economic vitality or not, but if you can afford them, you can use them. Any sense that plays any kind of a role into the prevalence of drug use in Olmsted County?
I wouldn't necessarily say so because a lot of the individuals that we work with that are using substances, they're unhoused and have lower socioeconomic status. So their individuals find a way to get the substance, whether that's directly through money or other means.
Thank you. I'm sorry.
Oh, it's not a problem.
Mr. Chair,
Yes.
this numbers, is this 2025 or is this
This is
go back farther than
January 2024 to today.
24 today?
Yep.
Okay.
So a year and a half.
Mr. Chair, I'm
Yes.
not quite sure how to frame this, but the fact that we're potentially looking at increased overdoses and increased overdose deaths as coming in as information from the state, that is only relative to the number of people using these substances. So it could still be the case that the response rate is improving, but the overall use of substances could be increasing and outpacing it. So it may not be entirely bad news. It could still be that our response rate is improving relative to the use.
Yeah, I wasn't saying it's bad news for our program. I'm saying it's bad news for our community. Another thing, you could just say that there's probably more fentanyl in the community than there was in 2023. So there's more deadly drugs out there.
And we are seeing people access resources more in just looking at alcohol related reasons for hospital admissions in 2023. I believe it was around 1,900, whereas in 2024, it was around 2,600 admissions for whether alcohol withdrawals or alcohol intoxication.
Okay. Any more? Thank you. That's very informative.
Thank you.
Appreciate it. Hey, next up, our favorite presentation, our annual medical examiner presentation. Or facts.
Mr. Chairman, fellow commissioners, thanks for having me here today. And so I'm the medical examiner, Ross Reichard, for Olmsted County and the Southern Medical Examiner Regional Medical Examiner's Office. And so I'm just going to sort of start off since we've sort of jump to the sort of the drug overdose component of things. And, it had me reflecting back on in 1997. Now you can do the math. My third year of medical school, I had to do a rotation in rural Kentucky and family medicine. So I was in southeastern Kentucky in 1997, and I was paired up with a primary care doctor who had me as a med school student, like see everybody first and do a fair amount of his work. But anyhow, he had just taken over practice from someone else. And they were probably 50% of the patients coming in, and every single one of them was asking for their anti-anxiety and pain medications. And it seems amazing in retrospect that was really the sort of the tip of the spear, the beginning of the epidemic. And here we are, almost 30 years later. And so I think it's important to think about like how this has spread and, a perspective on that. I mean, I would say, and we have the data in here, the number of overdose fatalities where the drug was consumed in the county and they died per 100,000 in Olmsted County is 20. The state mean is, our median is 23.6. So I would say that, I'm not trying to belittle it, but on a scale of like, 1 to 10, are you pulling the fire alarms? We're probably, if you use that data, at the 4 level. Whereas another place that I worked, and you talk about the causes of this in New Mexico, there's a county, and if you're ever interested in learning about this, it's called Rio Arriba County in northern New Mexico. And that for many years had the highest heroin overdose rate in the country. And it's this really rural, low populated area. But in that venue, there's multi-generational drug abuse where you have 12-year-olds learning how to inject heroin from their mothers and so forth. And in that kind of community, it's become endemic where it goes from generation to generation and has been frankly normalized. And I think that's the real terrifying aspect of the normalization potentially. But again, it's Rio Arriba County. It's also like on the heroin pipeline for drugs coming from Mexico up to the United States, up to Chicago and other areas. So just to sort of discuss the sort of perspective that I have on that. I mean, I would say overall, in southeastern Minnesota, we were pretty fortunate. We had 0 drug overdoses deaths in Houston County and 1 in Dodge County last year. And so I think, when I talk to my colleagues across the country and tell them that we actually have a county that has 0, people don't even believe me. The only counties that have 0 are places that don't have people. Right. And so I'm not trying to belittle it, and I'll get into the details of that, but I think it's important to have that kind of perspective that there's definitely some places out there that are bad in a different way bad. So as far as whether or not these are poisonings or overdoses, and so the public health term that you'll see is poisoning, okay? And so I refrain from using that term because if someone says they were poisoned, people immediately think that they were given something intentionally. So when people put poison on a death certificate, you get the call and say, who murdered him? Why is this an accident? So you'll see in our data, it's poisoning / overdoses. And so for us, we do a complete autopsy on every potential drug overdose death, and our investigators are going to the scene and going very carefully through the scene, the prescription medications, everything that is there to decide whether or not that we're bringing it in. So to do an autopsy. So I would say, to be quite frank, that on behalf of my medical examiners, Supervisor Monica Kendall, I mean, I'm just going to say, to be honest, in this Southeast Minnesota, we have the best death investigators in the state, I would say, and also including Western Wisconsin. And so we're bringing in cases and doing autopsies and finding drug overdoses, fatalities at a rate probably that it is exceeding other regions because we're actually bringing those cases in and doing those autopsies and doing the toxicology studies. I mean, there's cases that have come in on the weekend that I've really not wanted to do, to be quite frank. Someone that hasn't been seen in their house for a week and they got lots of medical conditions and like all sorts of things. So they have a bazillion reasons to die. But our death investigator thoroughly went through and looks in the prescription bottle, and it's like, this is not their prescription. And so they might have had a bunch of reasons to die, but they open up that bottle and it's filled with pills that are really fake, oxycodone and fentanyl pills. And it turns out to be a drug overdose death. And there's other jurisdictions that are not having that same due diligence on that cases. So in some ways, the better your medical examiner system is, potentially the higher rate your drug overdose deaths are going to be. But so it's reflecting that. But I think that's what we all here want. So we're doing a complete autopsy on all these cases. We're doing full toxicology. So we're ruling out the natural diseases, could be the underlying cause, traumatic injuries, or other sorts of things. And obviously, we're doing lots of investigation to see if there's anything at the scene that would lead us to some sort of other mechanisms of death. When we talk about the drug concentrations of fentanyl in these individuals, you know, when I first started seeing fentanyl overdoses, because epidemics of fentanyl have been around forever because it's easy to make, we would see things in the like a couple nanograms per milliliter of concentrations, okay, which is basically around what you would need for conscious sedation. So just, you know, not very much. There's not a lot in the medical literature because they're just monitoring you, but that's sort of like, I would think less than 10 nanograms per milliliter is what you would be looking for conscious sedation and even full anesthesia. We're now seeing drug concentrations of regularly of 20, 25, up closer to 30. So this is just orders and orders of magnitude beyond what you would see. I mean, if someone has completely naive to opioids and they put on a fentanyl patch of the 50 micrograms, that's enough for them to die from that, just to give you a sense of this. And we routinely have people that are taking larger quantities of this. So it's just the tolerance and the scale. And because of the concentration of the drugs, the risk to those who are around it is quite high. We actually had a situation, unfortunately, where our investigator and law enforcement were at a scene. They're investigating one other thing. They led to another room, and there was super concentrated fentanyl in the air, and they both lost consciousness and had to be transported. Okay, so this was, thankfully, there was a third person there that was able to call 911, and they used all the Narcan that was available to them on those individuals. So this is, so if you think you're taking cocaine and you actually get fentanyl and you don't have an opioid tolerance at all, you're going to likely die. And so that's the kind of, you know, risk that we're talking about here. So I feel confident that when we call something a drug overdose death, that's what it is. That the cause of death is a reflection of what that is. And, you know, whether you can say it's a bad batch or a good batch is probably dependent on the user, you know, because people are looking for these high concentrations of drugs, and law enforcement can chime in, but that's what they're often looking for, is their tolerances increase. I mean, initially it was mixed with heroin, and then basically just shifted over to fentanyl. And that's pretty much a financial and transportation decision by those that are doing it. It's a lot easier to transport small amounts of fentanyl and get it through wherever, ship it into the country, than it is huge vats of heroin. So it was initially used to cut down that heroin concentration, and then people have grown to like that high and that concentration that they need to maintain that, so they don't go into withdrawals. So, and for what it's worth, just to get a sense of what an opioid addict goes through, if you've ever talked to people that have been given Narcan, some of them will straight up tell you they'd rather die than be given Narcan again, because it's such an unpleasant experience, because you are gone into immediate withdrawals. And so I'm sure first responders can react to that, but you don't necessarily want to be in the line of fire of that person when they go from, you know, nearly comatose to immediate withdrawals. So, but anyhow, just to sort of provide some context. And so now let me just sort of get into the bulk, and we have some additional details as we get into the presentation. See. All right. So the blue area in southeastern Minnesota, those are the counties that we provide full death investigator coverage for, medical examiner coverage for. Sort of the light purple ones are ones that we provide consultative services for. So they're doing the death investigation, and we're performing the autopsies on behalf of them. You know, I would say if you cross the river to La Crosse, instead of going from like a 4 to this region, you would go to like an 8 as far as intensity. Really? So just for perspective. Um, So this is our group of death investigators. So we have 4 forensic pathologists. We've now added a 5th, so we're up to 5 forensic pathologists. Monica Kendall is our supervisor who's here today, and these are all of our death investigators. And I think I can safely say we're probably one of the only, if not the only, office in the country that has pathologist assistants that are our death investigators. And so our level of training and expertise and qualifications is it's categorically a step above most places. And they're triaging calls and helping to manage the death investigations that are also going on around the Southeast region. So again, it's a very high level of expertise. And this team, I can't say enough about because they're the 24/7, 365, responding to calls, vetting the calls, talking to families, law enforcement. I mean, they're really doing, the hard work, in my opinion. So what's on the death certificate, just to sort of level set, you know, it's amazing how much we talk about death certificates these days, which is something that no one used to be that interested in, but we have the cause of death, the underlying reason why they died, the manner of death is the circumstances. And then there's a whole bunch of other information on there that isn't on the public's death certificate, but is used by the health department and rolls up eventually to the CDC. And so this is very important for directing resources and understanding what's going on. It's obviously used by the families and relatives for closures and legal things, but it really is the key to the public health system here. And it's amazing because it's just like local government. It starts with the boots on the ground at 3 o'clock in the morning, finding the prescription or not illegal drugs in a venue. And that's what rolls all the way up to the big numbers that we see from across the country.
Sure. Can I just ask? So on the cause of death, is there a different across the state in terms of, let's just say, would you report a drug overdose on the death certificate in those words, or would you say fentanyl related drug?
We list the drugs there.
Okay.
And so that's really the best practices, is to list all of the drugs that were involved.
I'm really getting at, if we looked at state data, might the drug death related terminology vary enough so that we couldn't get really good data in terms of what's happening across the state?
So actually, I have looked at that. I collaborate with an epidemiologist who has access to all the death certificates in the state of Minnesota. So I've actually gone through and done that exercise and looked at that granularity. And there still are some death certificates that will be signed just as like multi-drug overdose or drug overdose kind of deaths without that specificity, which is a problem because you can't get that granularity. And so that was actually one of the underlying thought to be one of the underlying reasons there was a delay in response to the opioid epidemic, is because people were just signing them out as overdoses and people couldn't see that they were opioids. People were just really assuming this was like the, heroin, cocaine, PCP. People forgot about PCP. That used to be like a major issue. That's part of it. So there's been a real push by the medical examiner community to add that granularity so you can capture the very specific drugs involved.
Good, thank you.
Absolutely. So just to get into the data here in Olmsted County, 166,000. And I think it's interesting here because as the cases are reported to us in a variety of different ways, which we'd much rather have something reported to us and us do a preliminary review and investigation. In one shape or the other, we touch 85% of the deaths that occur in the county. And so this gives us a pretty good eye on what's going on. Some of our other counties are over 90%. But you would expect that there'd be some, because obviously there's natural deaths that are occurring in different venues that are anticipated. So we had 1,895 reported to us. We did 230, did autopsies on 239 of them. 210 were complete, 23 external examinations. We're starting to see a little bit of an uptick in our external examinations. Unfortunately, we have access to postmortem CT scans, and our radiologists can help us review those. But the scenario in which this is occurring is you'll have somebody who's on hospice and they'll have a fall and they'll maybe have an injury, but because they're on hospice, they're not taken to the hospital because they're not going to do any type of intervention. So we want to make sure that that kind of death is captured as whether it's natural or accidental. So we'll bring them in and do an external examination looking for injuries, and then do imaging to see if there's like hemorrhage within, in the head, like subdural hemorrhages or leg fractures or other things, because that's could potentially change the manner of death and obviously have significant ramifications depending on the venue. So, and so death certified with no autopsies, 292. And see, these are typically older individuals. They have some sort of injury. It's well documented what happened. They're hospitalized. And so that is how we typically do those. What I've been struck by recently is the use of baby cams on people's parents, so they're monitoring them in that same way. And so we actually are having a gradual increase in the number of these where we actually have documented. So it's not necessarily witnessed at the time, but there's documentation that the fall occurred versus just having found them down and presumed to be a fall. So I think it's interesting, and I think it's a great use of that technology.
Are these deaths Olmsted County residents in Olmsted County, or are these?
Yes. And I will get into that because I have that broken out in a couple of different ways, because as you might imagine, there's a hospital in town that attracts people from the region. So we have that separated out for ones in which the injuries occurred in the county and the deaths occurred in the county, and then injuries that occurred outside of the county, but they were transported and died within the county.
Okay.
So 1,364 we certified. We did not certify. So those are ones that we reviewed and turned back to the primary care providers to sign the death certificate. So on the next page here is the manner of death. As you might anticipate, the vast majority of the deaths are natural. And then we have accidents, suicide, and homicide. And so just as an example, to your point, there's listed 7 homicides, but only 5 of them did the injury occur in the county. So some of them were transported here. And so we can speak to more of that in the future, but there's a lot going on in organ donation these days, and they're transporting the individuals that are not just brain dead into our county or into our hospitals. They're beginning to transport people that are not brain dead, and then doing what's called donation after cardiopulmonary death, and doing organ recovery there. So we're probably, over the years to come, as that's going to increase, we'll probably see more of these kind of cases where you have the deaths occurring in the county and I'm responsible for signing the death certificate, but the injuries occurred in South Dakota, North Dakota, Iowa, what have you. So just as a heads up, there are 4 undetermined. And 2 of those, unfortunately, were co-sleeping of infants. And one was someone struck by a train, and another one just found deceased in bed. So, and we can talk more about these, or we will talk more about these in detail. So if you just take out the natural deaths, so these are all the unnatural causes, the jump and fall, or we have some more details on that. So those are our fall-related deaths: 33 motor vehicle, 33 poisoning or drug-related deaths, 21 firearms, 2 drownings, and 1 burn, and 5 asphyxia, those are really choking types of deaths. But I have more granular detail on those categories further on in the report. So this is homicide, and this is by location of injury. And so this is where you can see that we have this is based on the county of death. Sorry, I misspoke there. And so we have a total of 7 here. And again, 2 were transferred, 1 firearm and 1 of the sharp force injuries. So that's why you see 7 here, but there was really 5 in which the injuries occurred within Olmsted County. And so here's the per capita rate. And so again, relatively small numbers we're talking about. So since it's per 100,000, small numbers can move this. And this is based on the injury and having occurred in that county. So that's why you see 5 deaths here versus 7 that occurred in the county, because 5 is which the injuries occurred. So this is a new graph, my data person, Natalie Campbell, is awesome, but she keeps expanding my presentation. So hopefully you all find this helpful, but this is kind of an interesting way to look at it. So we're going from 2020 on the left to 2024, and she's color coded by the means in which the homicide occurred. And this is based on the county of injury. So you can get a sense of the nature of what caused the injuries over year. And you can see that it's pretty varied from year to year.
Chair,
Yes.
since we're on all this, and since there was a groundbreaking yesterday in Mankato on a new Bureau of Criminal Apprehension lab, I'm just curious, how does your office interact or otherwise relate to the BCA on a criminal investigation?
Yeah, so that's a great.
You have jurisdiction, or they have jurisdiction, or you share jurisdiction, or
so when the death occurs and
you double lab testing or whatever.
No, we have a great relationship with them, and the BCA agent or the Scientology area actually started on RPD years ago. So I feel like we've kind of grown up in this together.
Sure.
And so, and that they're a great collaborator. Honestly, we just had a case a couple weekends ago in which they came into our office. Maybe it's 2 weekends ago. So the way it works is they're a resource for law enforcement, and so there are some parameters, maybe in custody deaths where BCA is now going to come in as an independent investigator, but they're often called in from, complex, situations. Is there like a conflict of something between individuals, and then they can do their own investigation. But it's really done, I would say, in collaboration with our local law enforcement. And then they can be a resource that we use. They have, so there'll be things that we sometimes will collect from the body, or things that are collected at the scene that will be sent to BCA for testing. And so, yeah, so it's a mixture of things, but we definitely use that as a resource, and they're excellent collaborators with us. So.
Mr. Chair, if you don't mind a short interruption, I would say, first of all, they're also great collaborators with our office. We love the medical examiner's office. But additionally, it's a really important legal principle where the Supreme Court has weighed in on this before, that the independence of the medical examiner's office is really important. So we work with them, and law enforcement works with them, but in the end, their judgment needs to be their judgment. And so the law enforcement role and the medical examiner role run parallel, but ultimately they need to be independent.
Yeah, I can't emphasize how important that is. And that's why, it's important in our counties in this region. The medical examiner is distinct and separate from, it's not like a sheriff coroner's office and in some places around the country. And that's really important legally and for the public's understanding and comfort with what's going on. And it protects law enforcement, I would say, and us as well. So it's a nice way to work together. So
Thank you.
absolutely. Okay, so moving on to suicide by means. People essentially use what's convenient and close at hand, because many suicides, despite we often thinking about them being plotted out over time, many of them are really relatively spontaneous, even if it's been in the back of their mind. And so they'll, grab a belt and hang themselves. They'll, find an old gun in their residence. We did have one asphyxia, which was related to helium. So we do see that periodically, which comes from a book called The Final Exit, where they talk about putting a plastic bag over your head and using helium to basically exclude the oxygen. In the book Final Exit, it actually says to remove the bag and take everything away, and tell law enforcement and the medical examiner that they just died and didn't die from that particular means. So, but that's out there. And we do see those periodically, because these are unfortunately things that you can Google. I mean, there are some safety measures now. Like on a lot of my Google searches, I get a lot of warnings for help. Like, these are the numbers to reach out to, like when I start. But anyhow, fortunately, those things come up first. But there are, unfortunately, like a lot of information out there for people to, learn about these things. Suicide by age, we had one in the 11 to 17 and two in the 18 to 25. So, we're always sort of keeping tabs on that younger population. As has historically been described, it's often the isolated older individuals with multiple medical conditions that often commit suicide. And many of them we see like waxing and waning mental illness and depression and previous suicide attempts as well. So this is the suicide rate per capita. And so there's 26 ones in Olmsted County, but there was 4 that were transferred in. So that's why the number is different than you previously saw. The red line is the state average. So accidental deaths by type. We had, again, the asphyxia choking. 3 of those were food boluses. We had 1 electrocution, 2 drownings. We had 169 falls, which I'll go about talking about in more detail in a minute. 32 motor vehicle accident, 27 drug overdoses, and 7 miscellaneous other types.
So to my question, I'm sorry.
Yeah.
To the last presenter, was it 20? Could you just flip that back? Did we have 27 drug overdose deaths?
Yeah. So the number's trending down.
Okay.
Yep. And I have it broken out more specifically
Okay.
by the trends and also by the types of drugs that were used, and just a few more slides.
Okay. Thanks.
But our experience has been the same, where the numbers are trending down, but this year is very worrisome for being an uptick. So this is accidental deaths by vehicle crashes, 21 automobiles or SUVs, 5 motorcycles, 2 pedestrians. The others was an ATV, golf cart, tractor, and garbage truck. So really a whole mix of vehicles involved. And so the more population you have and the more things that people are out and about doing is a reflection of those different vehicles that are used. So we have 2 maps here. And so this is just the higher view. And so this is year over year by location. The size of the dot reflects the number of deaths that occurred in that region. Just because of the number of years it starts in the scale that we're talking about, it looks like there's some clusters in specific regions. But if we go to the next slide here, and we're zooming in, so you have a little bit more space to see, you can see that they're really spread out. And so again, this is something that we're providing. So hopefully if there's some spot that we see or others appreciate as a problem, I mean, I know there's some intersections that thankfully have been worked on. There's ones that, Monica and I can attest to that years ago, we were quite nervous about going into it. I mean, I know roundabouts are maybe not people's favorite things, but there's definitely some in some locations that I'm very thankful that they're there when I go through those intersections. And yeah, I'm being entirely serious. And so this is by the type of vehicle. And so again, you can see all the different types of vehicles in the location, and they're where you might anticipate them to be. So again, not any particular cluster, but I assume eventually we'll start adding e-bikes on here as my guess is the next category that we'll see.
What's the number next to the dot on those?
So the smaller dot's 1 and 2. Oh, the number, and that's what's the number next to the dot? Is that the GPS look? Yeah,
Okay.
so it's coming from yeah.
Mr. Chair, just as long as you're up to, do you have data on how many of these traffic fatalities have a relationship to drug or alcohol?
So we are doing that testing on all of these cases, so that's available. We're not specifically reporting out on that,
Okay.
But we do have that data, and it is in all of our reports. But that is something that, like the state patrol and other folks that are looking at traffic fatalities are definitely looking at and accessing. So that's where that's coming from.
Okay.
Yeah. Yeah. The only thing I will say is riding a motorcycle in the morning and evening hours around here with the deer moving around is very dangerous activity. So, yeah. So, sorry, let me go back. So this is the per capita rate. And so we had 12 in which the motor vehicle accidents, the injuries occurred in the county and the death occurred in the county. And then there were 20 that were transported here. So that's the big difference between it being a level 1 trauma center. They're being transported in. And that's another team that we have a really good working relationship with is our trauma surgeons, and we are regularly providing our reports. And so it's helping them to manage and learn from our autopsies. And so it's a very collaborative relationship. So accidental deaths by the falls by age group. And so as you might imagine, it's very much skewed to the right. You know, we're at the 95 plus category. Not that many years ago, we just said greater than 65. So for all of us here, that's good, good news. And so eventually we'll probably have to be even expanding that to 100 plus. And that's really related to falls. And we have the data of where this occurs. So in the other location, we had 1 at a hotel and 2 in parking lots. You have people visiting other residences where that occurs. 34 were in people's own residence, 45 in assisted living, 13 in a care facility, and 2 in a hospital. So I think the hope is that that would decrease, you know, as you move from assisted living to care facility to hospital. But again, those are obviously something that it's a major concern in healthcare, and there's a lot being done to try to address those issues. Okay, so back to drug or overdose related deaths. We had 2 with alcohol, 19 illegal, 3 mixed, 1 over the counter, 7 prescription, and 1 other. And that other was like an air duster, so a huffing related death. So this is by age group. And so, I mean, this is something that we are really seeing is the deaths in this older population, you know, this 45 to 64. In a lot of our counties, that's like the bulk, if not nearly all the overdose deaths. And so we definitely still see them in a younger population, but it's really the 25 to 64 age group and even older. And as you'll notice, there's 1 in the 65 to 74. And last year, there's 1 in the 75 to 84 population. So again, it's really following the demographics of our country in some regards. But I think it is important to think about it because it's not necessarily, you know, something that people are thinking about is like this 60-year-old going to be a drug overdose. People in their mind sometimes think, oh, it's the 20-year-old kid that's doing it. So this is the accidental drug overdose per capita. So these are based on the county of injury. So again, you can see 23.6 is the rate for the state. You can see Olmsted at 20 and see how we compare to the other counties. You know, and this, we used to have it on here, but you know, if you have like West Virginia or other things, it's probably double what this is. All right, so now to get into the year over year and the drugs used. And so you can see at the bottom, 2020 was our lowest number. And then, you know, we thought the epidemic was waning. We had the pandemic. We saw the numbers uptick. And then it has been decreasing. And so in 2024 was 16, which is really kind of a relief. And we've seen this in a reflection of just our autopsy numbers, and people have seen this across the country. You know, the years prior, they had some jurisdiction had whole medical examiner positions just to manage the deaths related to drug overdoses. So we had 3 with cocaine, 1 with cocaine and methamphetamine, 3 with fentanyl, 2 with fentanyl and cocaine, and then 3 with fentanyl and methamphetamine, and 3 with meth. And so meth has really never gone away. It's been, you know, it's been in the background the entire time. And I can't remember what year. I guess if you go back and it's, you know, 2020, you can see that methamphetamine was really the leading cause of drug overdose deaths in Olmsted County, which was not the same as other places where the opioid epidemic had really already begun to unroll. And so here's the natural deaths by causes: heart disease, cancer, and neurologic disease are all the leading ones. You can see pulmonary, that peaked again. That was related to the pandemic, and the lung injury related was SARS-CoV-2. One that we're tracking is a sort of a lagging sort of indicator or consequence or sequelae of the epidemic has been liver disease, where people began consuming more alcohol during the pandemic and have maintained that. And this is a thing where the liver injury takes years to generate. So we had 76 liver-related deaths, and 46 of those were related to alcohol. So just to get a sense of the effect that alcohol has in that area. And so that's thought to be sort of a residual effect of the pandemic.
Dr. Reichert, what gastrointestinal, what is that, like stomach cancer? Or?
Yes, it could be stomach cancer, or yes, it could be anything related to the GI system. So like an upper gastrointestinal hemorrhage or something like that, or any sort of problems with the GI system.
And then neurological, is that stroke?
It could be stroke or dementia, but not the traumatic injuries. And so we did think that there was going to be, as the population ages, or 1,000 baby boomers, turning 65 pretty regularly. And so we did think there was going to be an uptick in neurologic disease related to dementia. And there has been some, but it hasn't been quite the epidemic that was anticipated, which is good news. And that's probably related to taking care of other risk factors like hypertension, cholesterol, and those sorts of things. And so this is alcohol related. This is another new slide, alcohol related deaths by manner of death. And so unlike other drug overdoses, chronic alcoholism is captured as a natural disease, and that's for historical and, a lot of different reasons. So if you're a chronic alcoholic and die from the complications of your chronic alcoholism, it's categorized as a natural death. We also have the non-drug related accidents and drug related accidents. And so these are when they're mixed with other drugs. And so we still see people drinking alcohol and taking acetaminophen as an example, and they present with acute irreversible liver injury would be that type of setting. So again, another sort of way to look at it. And then we have some people will just consume such a large volume of alcohol that will classify it as an accidental death because of that. So it's truly like an alcohol poisoning scenario.
So, do I understand this correct, that when you say natural death, that the bars there show which ones were related with alcohol, even though it's a natural death?
Correct.
But kind of like an oxymoron, then, isn't it? It's not really natural.
Yes, but that's the way that historically have been captured because it's been seen as a chronic disease. And so in the medical community, chronic alcoholism has been seen and recognized for quite some time and coded and so forth as a chronic illness. And so because it's considered a chronic illness, then we categorize it as a natural. Although intuitively, like you said, it seems like an outside toxin is ultimately the result of the underlying death, but that's the way it's been categorized. Deaths by age group. Again, the further to the right you see, the better. It's a quick way of saying that people are dying of their natural disease. The more bumps and spikes you see towards the left, that's younger population. So that's reflecting non-natural deaths because the younger individuals aren't dying from their cancer or other chronic conditions. And so these are the suicides, accidents, and homicides.
So why in some categories we have like 18 years, 26 to 44, and then in others we have 8 or 9? Does that kind of skew the bars then?
Yeah, why is it 4 versus it's just showing that age bracket.
I know, but I mean then.
Yeah, I'm not sure why it's categorized, and they have sort of varying ages. We can go back and ask. This is coming directly from our database and software that we use for death investigation. So yeah, I never thought about that. I just looked at them as the numbers, but I can see why it might make it look like it's more one category because there's a larger age.
Exactly.
Yeah. So
I think some of that is sociological age categories that are traditional, and the medical examiner may be just using those.
it probably is. My guess is if it's probably linked back to like the CDC's like standard, but I would have to actually look at that specifically. That's a great question. I'll look into it. Thanks. And then this is just a summary of our activities. from year over to year. 1,049 investigations, signed 531 death certificates, went to 215 scenes, 239 autopsies, and 1,895 deaths reported to us. So pretty stable year over year. And you do see a slight decrease, and that's probably a reflection of somewhat a reflection of drug overdose and accidental deaths, as we've seen that, and even some natural deaths. We've seen that decrease since the pandemic.
So we didn't see a big spike in deaths during COVID.
We did, but so it's interesting because so initially when you have like an epidemic or ultimately a pandemic occurring, and it's caused by like a virus, for example, those are medical examiner cases because it's not really known what's going on and you're trying to see what's happening, and they're reported and treated that way. Once you now have the testing and now know that, hey, this death is being caused by COVID, then those now switch in and become a natural death. So initially we'll capture those as medical examiner cases. Then once the testing is available and they can say, oh, we got them to the hospital, we tested them, it's the flu, and they died later, then that's a natural death. So it wouldn't be, recognized in the medical examiner data. But I can tell you that from the autopsy service, we saw a huge bump in our autopsies and our in-hospital deaths related to that.
Okay.
So if you had to choose the drug that causes the most misery, right? Because I can see here that the deaths, like fentanyl is associated with deaths, but then the alcohol shows up in all of these things that are related to that. So if I was a public health official, should I focus on alcohol or shall I focus on fentanyl?
Both.
Well, thank you very much. I appreciate that answer. That's really good. Thank you.
No, but I will say, I mean, you are correct. I mean, alcohol is not a trivial public health concern. Same with nicotine and tobacco, and vaping, and there's lots of things that are out there, and it's that's a societal question that's beyond my scope. But I mean, it's something that we obviously talk about because we see it on a daily basis.
Yeah. Well, one of them is much more socially acceptable, so it doesn't seem so bad.
Yep. I mean, it's a cultural component, right? I mean, it's the society and the world that, we live in. And so that's really beyond the scope, and that's what people use. And hey, I was an anthropology major. I can talk about this all day long, but every society forever has always had some sort of, intoxicants and other things that they've used for whatever. I think that's a deeper issue of like what's going on with the human brain. But I'm also a neuropathologist, so we want to talk about that too.
Maybe you could.
I'm happy to cover the neuropathology of this and the reward system and dopamine and so forth.
Right. I would recommend that you come back and talk to us about the human brain sometime. I think that would be just terribly fascinating.
Whenever you want me to do that, I'd be happy to. I can talk about dementia or traumatic brain injury, whatever you find interesting. If you're all close meetings, small group meetings.
That's great. Laurel.
Dr. Reichert, you mentioned vaping.
Yep.
I know this is a relatively new substance delivery technology, and there's not a lot of research because it is so new, but are you seeing vape-related deaths or vape-related injury leading to death?
So, what we have seen is vaping associated lung injury, and some of my colleagues at Mayo were actually some of the first ones to describe it. And so you have contaminants that get into whatever substance they're vaping, and it causes this severe lung injury. So that's really the venue in which you see the vaping associated injuries is the lung injury from the contaminants within it. And where we've seen this has been in outbreaks where people are basically selling, illicit THC, and it has contaminants in it, and they're vaping the THC.
And do you happen to know if these examples are found in children, minors, youth, adults?
I don't know the age bracket. Thinking back to the ones I've seen, it's sort of like young adults. I would say like 17 to 25, but don't quote me on that. I'd have to go and look, but that's anecdotally what I'm thinking.
Thank you.
Yep.
This is your last slide?
Yep.
Okay, Dave.
Are you done?
Yes.
These are just wrap up curiosity questions. And you deal with mortality every day, obviously. And a couple of things that counties are involved with, and I'm sorry, I'm just going to put you on the spot. I think I know the answer anyway. But and for instance, this morning we talked about PFAS, and every county in the country is talking about PFAS and PFAS liability and so on and so forth. In your scans, if you will, not necessarily radiology or anything else, but when you're in the secretions that you sample and so on, do you get into that at all? Is there, in other words, is there an endemic, if you will, level of polyfluoroalkyl compounds in human bodies in Olmsted County?
So I don't know the answer to that specific question, but one of the reasons why we were looking at things like cancer deaths and so forth is to see, based on the population, where are there like upticks or trends? Because it is a different community because you have farmers and rural populations. It's not the same as the urban areas, which is actually sort of a distinguisher. And so people started to look at that in like our Alzheimer's Disease Research Center and other things to say, okay, because there are some examples with like, pesticides in association with Parkinson's disease and other things. And so when the NIH is actually looking at different categories, of socioeconomic categories, urban, rural, that there's a large population that's in our region that would fall into that rural county. That rural classification. I don't remember the exact numbers, but it's based on like the population density of that area. So that information is being gathered, and that's how you would have to find it. The real challenge with those types of things, so like, for example, like Agent Orange or these things, it's like, how do you take an exposure that was potentially at a very low level or maybe moderate level, but years ago, and you're looking at it horizontally, and then factor in the numbers of other cancers that could be totally unrelated. So getting to statistically significant and reliable data on that is super challenging in those kind of scenarios, to be quite honest. That's why when you hear about these exposures, it's usually like more of like an acute small community where you see like, oh, like all these kids got sick, or there's this really dramatic uptick of leukemia or whatever. I'm just throwing things out there because that's enough to move the needle to say this is definitely different than what we would expect in this region. But as you take larger volumes of people, then you need even bigger numbers as a comparison.
Counties can, at least in this area of the state, nitrate, nitrogen, and groundwater, and I mean, you can spend millions. You can host a town hall and have 500 people come and so on and so forth. But I'm not suspecting you see a lot of that in the data that.
Not from our perspective, but that is something that why we're capturing that data. So if you did see like a spike in a particular county or region in something, then we would have that kind of information.
Okay, thank you.
Absolutely.
Questions?
Mr. Chair, I would just say very interesting.
I agree.
I hate to think death is interesting, but it can be, I guess.
Well, I appreciate the time and the interest. Thank you very much.
Thank you. See you next year.
Yep.
Okay, next up, update regarding SNAP and MFIP federal impacts.
Chairman, Commissioners, thank you for a little bit of time just to talk about this. In addition to the updates, we actually also need you to approve the purchase of service agreement with Channel One and to delegate that signature authority to Amy Rockwater. So the reason for that is it's a purchase of service contract over $175,000, and that requires the board to take that action. So before you do that, though, I will just provide a little bit of an update. We recognize and appreciate the funding that the county board has provided to try to address some of the gaps created by the SNAP shortfalls as a result of the federal government shutdown. And since the board last took that action, I mean, a lot of things have happened. And even since last Friday, a number of things have happened. And I just want to provide you with a little bit of an update and some context in regards to our current situation. So first, as it relates to SNAP specifically, On Friday, last Friday, a federal court, in fact, two federal courts issued an order just requiring the USDA to use some contingency funds that they had to help with this gap that's created then in the SNAP. And roughly that was just under $6 billion. And we know that amount will cover roughly half of the amount that the federal government commits to the SNAP program on a monthly basis. So what they've suggested will happen as a result of that is that recipients of SNAP could expect to receive about half of their normal benefit. So that's the kind of the news around that. What we're hearing from the state is that they don't yet have the funding from the federal government. And what they're working on right now then is to figure out a process in which they could, in fact, basically put a percentage of the benefit that the person normally gets into the system then that provides that benefit onto the cards that people use. So they're working on that process while the federal government is working on the process to actually release the funds and get it to the state so that the state can issue those benefits. That's kind of a long way of saying the efforts that you put forth and the dollars that you put forth to Channel One, they're needed. They're not going to go unused. So we haven't slowed anything in regards to our process, and that process remains to get some of this food out to the community as early as this Friday. So there's been a ton of work done internal. So I praise the heck out of the staff from the county that have been working on this, and even more so the staff from Channel One that have been working to make sure that the distribution on that end happens as well. There's been a ton that's happened since the time this board made that decision, and the efforts are really quite impressive. So we'll be ready to roll on Friday, and we will keep you updated in regards to what happens then with those federal dollars and how that impacts our local community. In addition, I know you've heard that the governor actually decided to use $4 million. We still don't know how that $4 million will impact us here locally. So once we learn more about that too, we'll be sure to let you know. The other thing, just to also mention maybe one more time too, is, I mean, we're talking about 5,900 households in Olmsted County and about 10,700 individuals in Olmsted County that are impacted by these changes to SNAP. So the other thing that bears mentioning is as it relates to WIC, I know that the Women, Infant, Children program is also something that this board made a commitment to fund staff. If you recall that decision that you made, you decided that we would continue to fund the staff. And in fact, there have been changes there too. So we just learned, I believe this morning, that the WIC program now is going to be funded through the month of November. So both the staff component and the food component. So we're good through November at this point. And we're still uncertain in regards to what that means for December, but we'll continue to kind of watch this evolve here over the course of the next few weeks. Let's see, as far as the Channel One demand too, I did mention to Virginia that I'd be happy to just provide a little bit of an update there. They're now seeing about 550 household visits per day, which is an increase from about 450 household per visits a day, or visits per day that they were seeing before this news kind of broke. So they are seeing a significant uptick in regards to the number of folks that are coming through Channel One to access food. And so the idea right now then is that between the work of the county and the work of Channel One, that about 5,000 food boxes will be distributed on Friday across 6 locations then within the county. The SNAP recipients are registering for that, and they've been notified of these locations. And Channel One has done a fantastic job also recruiting volunteers to help with the distribution of that food. And yeah, I guess I already mentioned where those locations would be. So, Amy, what did I miss? Jenna, anything to add? Okay, so that's kind of the update as of it's 12:50 now, and by the end of the day, we'll learn something new. But we'll keep you informed as to what changes. And I just wanted to make sure that we were clear in saying we're ready to roll. The funds are going to go to a good use. problem isn't solved for. And we'll get us through November and see what December brings. So with that, I'd look for a motion then to approve that purchase service agreement and authorize Amy Rockwater as the signature on that purchase service agreement.
So moved.
Second.
All in favor, say aye.
Aye.
Oppose? Carries. Thank you. All right, long meeting. We'll go to board committee reports. Bob, you want to start?
Nothing to report.
Okay, Brian,
No report.
Michelle, Dave.
Commissioners, Mark and Rossman and I were in Winona a week or so ago and to the AMC district meeting, and I'm forgetting what the priorities are, but mental health and system revitalization, and I forget the other one, but all good, and we represented you well.
Right. Laurel.
Today on our consent agenda, we approved several people to as new members of our citizen advisory boards and commissions. And I know that Commissioner Mueller mentioned this last time, and I also wanted to say that all the applicants for these boards and commissions were excellent. It was regrettable that we couldn't appoint them all, and that we just encourage anyone who applied and went through an interview to apply and try again for either that board or a different board, because it is an excellent way to be a citizen and involved in local government.
Thank you. Greg.
No report.
Okay, I'll end with a short quote from Daniel Goleman, an author, psychologist, and science journalist. And he said, when we focus on ourselves, our world contracts as our problems and preoccupations loom large. But when we focus on others, our world expands.
Move to adjourn.
Second.
Adjourned.
Now right into this thing.
What's that?
We're right into this.
I think we are. Aren't we? Go right to admin.
Yeah.